and tips for the public. Next, we'll have Dr. Lawrence Skuvanik, who is the Texas Tech University president, and he will give us a Texas Tech University update. After that, we will have Councilmember Steve Massengale give us a Lubbock Economic Recovery Task Force update. And then finally, we will have Mayor Dan Pope as he'll talk about COVID-19 data analysis. So right now, I'm going to turn it over to Ms. Catherine Wells to give us the latest information on our current cases.
Thank you, Abby. Today, and thank you all for being here today. I'm going to give us a quick update on the number of COVID cases and also talk about some of the trends that we're seeing out there in the community. The health department is reporting 7,754 cases as of yesterday evening. This is a significant jump from where we were last week. Yesterday, we saw our largest daily increase in cases, and we expect to see another large increase today. The health department, along with our universities and school districts, are closely monitoring case counts and patterns of disease. This is the whole goal of contact tracing, what we've been doing all along. We will continue to call and interview cases, and we will work with businesses, schools, and property owners to mitigate risk whenever we find or a hotspot is identified. The good news is that we're not seeing spread in school districts or at structured gatherings where masking and social distancing are followed. This shows that we can get back to some sense of normalcy while we deal with this virus. However, the spike in cases over the last week is attributed to unstructured activities, such as indoor gatherings of more than 25 people inside a private home, large house parties, and groups interacting at outdoor venues such as pools. At this time, we cannot safely have these unstructured gatherings. I know we all want to get together, but if we want to continue to reopen, attend school, and keep our local businesses open, we need to follow the same guidelines that we've been talking about since March. We all need to make sure we thoroughly wash our hands often. We need to stay physically distant. This means limiting the size of gatherings and also limiting the number of people you interact with. And the most important thing is to wear your mask, especially at those times when you cannot be physically distant or socially distant from others. At this time, I'm going to go ahead and turn it over to Dr. Cook.
Thank you, Catherine. Let me reiterate what Catherine just said is most of these occurrences with our increase in numbers is occurring off campus. Almost 2/3 of those new cases are in the age group between 18 and 25. So certainly our college age group. Not everybody in that age group goes to college or university, but that's what we're seeing. We as the health department and medical authorities are working closely with our universities and colleges to educate and encourage and to continue to practice all the recommendations from CDC that include safe distancing and facial coverings and washing of your hands, even when you're off campus, especially when you're off campus. I know that colleges and universities have gone to great extent to provide safe environments for education. So I believe that most of these cases are happening off campus, or these exposures are happening off campus. Please know that we have plenty of resources for people to get tested. We have the Rogers Gym, we have TDEM, Texas Department of Emergency Medicine. The contractor for colleges and universities is coming back. It'll be here next Wednesday, a week from today, and we're making negotiations and access to increase our testing in between that time. So the next thing I want to talk to you about is there's a recent tweet that went out that said only 6% of all the recent deaths are related to COVID. That's a bit of a misnomer and misinterpretation of that data. There's been lots of conspiracy theories and lots of stuff on the internet related to this. Filling out a death certificate is somewhat tedious and not always clear. And I'll give you two examples. The first example is when you come to the hospital, say you have COPD or emphysema, and you come to the hospital because your breathing became worse and you developed a fever. So then we see that you need to be admitted. We test you and you're tested positive for COVID. And so that we put you in the hospital and try to take care of you. You subsequently develop a pneumonia by a bacterial infection related to your poor lungs and COVID and all the things that COVID does to your body and your lungs. Then that turns into a bacterial pneumonia, and then that bacterial pneumonia spreads to your bloodstream. And then that bloodstream infection affects all the other organs in your body, and essentially all your other organs shut down. We call that multi-system organ failure. Unfortunately, in this scenario, you pass away. How do we list that death on the death certificate? Certainly COVID is a factor, but that's not the number one cause of your death. COVID in itself doesn't cause death. Its manifestation in your body causes a death. So we would probably list multi-system organ failure as your number one cause of death, complicated by an infection or respiratory failure, followed by sepsis, and then another contributing factor. There's a line on there for other contributing factors. You would say COVID. So that's the complicated reporting structure of how we report COVID infections. That one's pretty straightforward. Let me give you another one that's a little more complicated. So you're in a bad car wreck. You're ejected from the car and you're brought to the hospital. And you have multiple bone injuries, you have lots of organ injuries, and you have a bad head injury from being ejected from the car that was moving at a high rate of speed. As a result, we know that you're going to be in and out of the operating room, and we want to make sure and keep you and the people that take care of you safe, so we test you for COVID. Sure enough, you're positive for COVID, but that doesn't tell us when you had COVID. Before all this accident happened, we get the history that you were feeling just fine, but you're positive for COVID. So unfortunately, you succumb to your injuries within a day or so. So what do we list on the diagnosis as what caused your death? We would say massive trauma, and that's in a car wreck, and that's what caused your death. Where do we put COVID? We don't, in this particular scenario, I don't believe COVID contributed to your death, because you may have had it 6 weeks ago or a month ago, and you may have been shedding virus. We just picked it up on the COVID test, but I don't think it contributed. As the healthcare provider taking care of you, I don't believe that it contributed to your death. So in this particular case, I wouldn't list COVID on your death certificate. I would say the massive trauma from the car wreck is what caused your death. But I had this diagnosis of COVID. So that's what makes it somewhat difficult. Where do we put COVID in here? And let me also include here, no physician puts COVID on a death certificate just to get paid more. We don't get paid more for the diagnoses that are put on death certificates. We want to report as accurate information as possible on those death certificates, because the Bureau of Vital Statistics uses that data. So that goes in, that last scenario would go into a trauma registry, so we see how many deaths are related to car wrecks. We also use the first example, because you had emphysema or COPD, we would list that as how many people had complications from their respiratory disease and or subsequently died of end-stage COPD as complicated by COVID. So it's not always easy a clear picture. We take it very seriously how we code those diagnoses. So I hope that sort of clears up the conspiracy theory. That in that particular case, of that 6% of those that died, COVID was the only thing listed. It didn't list any other comorbid conditions or the sequelae of COVID, those things like blood clots and respiratory failure, infection. None of those were listed on those. That doesn't mean they didn't have those. The last thing I want to cover is flu. They mentioned it last week. I'm sorry I wasn't here last week, but please go get your flu shot. We already have one pandemic. We don't want a twindemic. So please go get your flu shots. Many pharmacies already have those. Flu typically starts in late October and typically peaks in February, early March. So let's go ahead and get that flu shot so you have the antibodies around, so when you're exposed to flu, you won't get it. Here's the good news. I think that if we continue to wear facial coverings, keeping our social distancing and washing our hands, I think our number of flu cases will be lower, especially in those individuals that do all four of those. Get your flu shot, wear your face mask, keep your social distancing, and wash your hands. That's all that I have today. I'm happy to answer questions at the end. Let me introduce to you Dr. Lawrence Skovanec. He's president of Texas Tech University. Dr. Skovanec.
Thank you, Dr. Cook. Over the last several months, we have planned extensively for the reopening of campus. We've done that in cooperation with the city, with medical experts, and state and local health authorities. And as we planned, we knew there would be times that we would have to deal with a spike in cases, and we've seen that in the last couple of days. On campus, we have a very controlled environment. It's more difficult to deal with the activities that take place outside of that environment. As we approach the holiday weekend, we'll be issuing some communication tomorrow, asking students, faculty, and staff not to travel, and then to remind everyone again of our need to follow all of our safety and policies and protocols. As of yesterday in our dashboard, we reported that we have 418 active cases. 388 of those are students. That's less than 1% of our student population. And in support of the comment that Dr. Cook made, we do see that in our dorms, where we have more than 7,600 staff and faculty, as of yesterday, we had fewer than 100 cases. It's also good to note that we have no hospitalizations among our community at this time. We're also carefully monitoring whether or not there are any obvious hotspots. No one dorm seems to be more of an issue than the other, and among our student population, that doesn't seem to be the case at this time. I get a daily report, for instance, on the number of cases in fraternities and sororities. So again, I would mention that this is what we've been planning for. We think our numbers are manageable. We have adequate space for self-isolation, and we're securing additional space in the event that that will be necessary. Later this week, we will be adding additional testing capacity with a walk-up clinic in Urbanovsky Park. And next week, Wednesday, September 9th, the Texas Department of Emergency Management will be on campus to provide free walk-up testing as well. But as we continue to monitor and carefully monitor these numbers, we are continuing with plans, alternative plans, in the event that the case count or the rate of increase rises to a level that we feel compromises our health and safety. That decision to go to an alternative plan would be made in consultation with the city, medical authorities, and health authorities, as well as with the faculty and staff. But we would consider the possibility of going online for, say, 2 weeks, but maintaining the presence of our students here on campus. That strategy has been employed at other universities, and those results have seemed to be effective. So at this point, we're carefully monitoring our situation. We very much appreciate the cooperation and support of the city as we deal with this. And at this time, I will turn it over to Councilman Steve Massengale.
Thank you, Lawrence. Good morning, everybody. I want to talk about a topic that you've already heard mentioned here many times this morning, and that's gatherings, and talk about a specific gathering that's important to all of us at this time of the year, and that's tailgating. Keep in mind that the governor's order as it relates to outdoor gatherings is still in effect, and that also applies to tailgate gatherings. So our Lubbock Economic Recovery Task Force Committee, the committee that worked on all the reopening guidelines, met this week to discuss what guidelines would be appropriate for off-campus tailgating. Keep in mind, Texas Tech has already released their guidelines for on-campus tailgating. And so these guidelines that are associated with the Lubbock Safe program would apply to off-campus tailgating. Now, these guidelines will layer right on top of our outdoor event guidelines that we already have in place. And as a reminder, from 10 to 49, we have a checklist that you can go through and self-certify yourself and email that in so that we have that on file. Groups 50 or more will still require the mayor's approval, and so that will apply to tailgates as well. Let me remind everybody where to go. mylubbock.us/LubbockSafe, and that's the page that continues to grow and has all of our resources as it relates to COVID-19. When you get your checklist, if you're self-certifying 10 to 49, you'll email that checklist to LubbockSafe@mylubbock.us. Here are the high points. First, the big point is that we need distance between tailgates. And so for perimeter to perimeter of tailgates, you need to maintain 40 feet. You could also judge that by 4 parking spaces, but 40 feet between tailgates. Those approvals for tailgates are going to be on a game-by-game basis. So every time you're ready to have a tailgate, if you want to have it for the Houston Baptist game, you'll need to communicate with the mayor's office. We're going to work carefully with property owners, especially property owners that tend to have multiple tailgates on their property. And we're going to try to get ahead of it and communicate with them so that they understand the rules as they sublet that property out for tailgates. One change as it relates to the tailgating guidelines that's different than our outdoor events is we've got a 5-day lead time on it, because we know you might not make your decision to tailgate until we know kickoff time, and we know sometimes those kickoff times don't come until 7 days before, and so we put 5 days in there to handle that. So that concludes my comments about LERT and tailgating guidelines and where you can find them. I'll hand it off to Mayor Pope.
Good morning. Thank you. Thank you, Councilman. It's good to be with everyone this morning. I'm going to start with data slides, as is my practice. Bear with me as I share my screen. Okay. So first, positivity rate. You can see that after getting back down to right at 6% on our rolling 14-day average, we are now up between 9 and 10% as of yesterday. Now that makes sense as we've seen more spread in our community, but we want this number to be at or below 6%. If you go back to the very beginning of this to mid-March, we were at that level. But what is most important is our experience, our most recent experience, and this is our 2-week experience. Hospitals remain strong and available. We've been in this 80 or patients or below now for close to 3 weeks. You'll also know that the acuity has shifted. That is that we have nearly twice as many patients on the floor as in ICU. So that's also a bit of good news. You've seen this slide from me for a month or so as we've prepared to reopen our schools, our K-12. Once again, 141 active cases and 3.5 times as many as those cases are recovered, so 474. This is a new slide for this week. You'll see this is age 18 to 24. And once again, many more recovered than active. However, this slide will give you a bit more of a deeper dive. And 2 things I want to point out. It wouldn't be a surprise to you based upon what you've heard from the other 4 speakers, but there are nearly as many cases between the 18 to 24-year-olds in the last 14 days as the entire balance of our population. So that's our focus. Now there is some good news here. The community spread among 25 to 49 has really slowed down, and I think that's very positive. Okay. So a few other comments. First and foremost, just a minute to pause and express our sympathy to the families who have been impacted by COVID-19. We've lost 101 of our neighbors. We've also had businesses that have closed, and many families are struggling. That's something we never lose sight of. For 169 days, I believe that's since March 17th when we reported our first case. And really, even before that, our response to COVID-19 has been one of partnership, and I think a spirit of collaboration would describe it well. And that's with business. That's our nonprofit social service sector. That's our churches. That's K-12, and certainly it's higher education. And Texas Tech is at the top of that list. We will continue to follow this path. It works. We've engaged those leaders, including Dr. Skovanec, in our Lubbock Economic Recovery Task Force. And every day there are conversations between Catherine Wells and her peers at Texas Tech. Dr. Cook serves as both the Public Health Authority and a Texas Tech University Health Science Center faculty member. So he gets to play both roles. And very few days go by that I'm not in conversation with President Skovanec or Chancellor Mitchell or their offices as we're sharing information and preparing for our response. Now, all along, we've learned that job one for us is to prepare for the unknown or the unexpected. And although we expected a rise in positive cases when students came back, yesterday's jump was a bit unexpected. I talked a couple of weeks ago about looking at this whole COVID-19 response a bit like a football game. We're somewhere in the middle of the game now, and we, I think, a couple of weeks ago, we had taken a bit of a lead. We'd battled back from behind in June, where we dealt with some serious spread, and in early July, and we'd taken a lead, but we knew that the opponent was still there. And I feel like yesterday afternoon we threw an interception for a touchdown for the opposing team, and so we're going to continue to stay the course. There's a lot of game to be played, and I want to remind you of that. And that's not what you want to hear, but that's where we are. Please don't lose sight of that. Now, testing is available, and testing has been part of our successful response to COVID-19 from the very beginning. You can get tested free at Rogers Park. I said free, okay? That's in the 3200 block of Auburn. So just east of University, just east of the Rawls Golf Course. You can drive there. It's in the Arnett Benson neighborhood. Drive up, walk up, free testing. In fact, on this Saturday, the 5th, we're expanding our testing capacity so you can be tested from 8 in the morning to 4 in the afternoon. If you have questions, don't hesitate to reach out to the health department, 775-2933, or visit the health department website you can access from www.mylubbock.us. I want to remind you to be kind and to be safe and to be hopeful. I'm going to add one to that. Let's be patient. Let's continue to respond to COVID-19 with common sense. Let's take care of our neighbors. Let's do it the Lubbock way, the West Texas way. It's important that Texas Tech be able to educate kids face to face. I believe that's why many parents have chosen to send their students to Lubbock. They know that we've taken this seriously. We're socially distanced by nature, and we can do it safely. Our businesses have safely reopened. We need to continue with a trend going upward and forward. Let's do this, Lubbock. Thanks for letting me share this morning. Back to you, Abby.
Thank you, Mayor Pope. Now we're going to move towards the media questions. So first up, we have Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Dr. Skubinek, can you just please talk a bit about how you're reaching and how you're getting your message across to these students who live off campus about, the protocols that you all would like to see?
Well, Matt, we've communicated extensively through the TTU commitment plan, but I believe at this point it's going to take a more concerted effort to reach those populations off campus, and we're planning to begin that tomorrow with a more focused message to those students. We're also communicating extensively with parents and students of those who are isolated, making sure we stay in touch with them. That's not the group you really focused your question on, but I think it's important to know that when students are tested positive, we're delivering meals to them in isolation. So there's a very broad communication plan here, but we're going to have to be especially diligent to those students off campus outside of our controlled environment, appealing to their sense of responsibility to be as careful as possible.
Mm-hmm. Thank you. And thanks for being here. And Mayor Pope, it sounds like, or Ms. Wells said, a lot of the cases are, indoor gatherings, large house parties, things like that. Anything the city is going to be doing differently moving forward?
We have been working with Texas Tech, and I'm talking, that's law enforcement, that's LPD, that's our fire marshal's office working with Tech and similar organizations there. We've also worked with the Dean of Students office and the student organizations. We're taking this very seriously. We're breaking up parties. We're issuing tickets if there's violations of alcohol violations. We will look for hotspots in the community, and if we see hotspots, for instance, a apartment pool, mm-hmm. something, we will work with the apartment to make sure we slow the spread down, to make sure they understand the significance of what's going on, Matt.
Mm-hmm. Okay, thank you, everyone.
Hey, before we go back to a question, I need to clarify something. I said earlier that the Rogers Park testing was from 8 to 4. It's from 10 to 4 on Saturday. 10 to 4, Saturday, the 5th of September.
Thank you, Mayor. Thank you, Matt. Next up, we have Sarah Self-Walbrick with Texas Tech University Public Media.
Hello, everyone. President Skubinek, glad to have you on here today. I wanted to start a little bit about how, for President Skubinek, how reporting cases on campus has gone, specifically self-reporting of cases. Can you walk us through that process and how it's gone so far, how accurate you think that has been?
So Sarah, the manner in which cases are reported is coordinated with the contact tracing process that we have. We get some of that information from the Health Wellness Center. We're also collecting information separately from athletics. Our plan is to ultimately make sure that's all coordinated through one reporting mechanism. I spent well over an hour yesterday sitting with those who are responsible for reporting the data that goes into the dashboard to make sure I fully understood the way this information is checked and validated. A lot of our cases are self-reported, where a student calls in to the Health and Wellness Center. They have to fill out a form that says where they took the test, when they took the test. So self-reporting is a large part of our numbers. I think the process is accurate. we do find some discrepancy because some of these dashboards are updated in real time. And when you take a snapshot to compile the report, data can continue to change. And so those are things we deal with, but we're trying to be completely transparent and as accurate as possible.
That was helpful. Thank you. And then a follow-up to something you mentioned earlier about accommodations for students who have tested positive. Can you go into a little bit more detail about what that looks like and what the current availability for those accommodations is?
Working through housing and through our CFO, Noel Sloan, last summer we began to contract with apartments and hotels to secure rooms where we could isolate these students. Sometimes students are encouraged or they choose to go home. But at this time, we have less than 100 students that are in these apartment units and the hotels. We deliver meals to them. We stay in touch with them on a daily basis. Yesterday, we went back and secured more space, and we're to cover our needs, but we're in the process of right now to negotiate for even more to make sure that we have enough space to deal with the cases that we have.
Okay, good deal. Thank you, everyone. Take care.
Thank you, Sarah. Next up, we have Matthew Stell with KMAC News.
Thank you so much. Excuse me. Thank you so much, Abby. My first question is for Mayor Pope or for anyone who can ask this. Yesterday, we doubled the amount of daily cases that Houston had. Is that some concern as we go into September, or do we think we can bring that number down if we all do the right things?
Thanks for your question, Matt. I don't pay attention to Houston, as you might imagine. My focus is on Lubbock, Texas. I'm glad that both of my feet are planted right here. It's certainly a concern, but as we said earlier, we've been through this before. We had an early spike, and then we calmed things down, and then had a mid-June to early July where we had something that really tested us, and we learned a lot from that. And now we've had a spike that we really expected. I think that's maybe the difference this time, and we're going to respond to it. We're going to test. We're going to trace. We're going to isolate. That's our strategy. That's been what we're doing from the get-go. That's the city strategy. That's Texas Tech strategy. That's Lubbock ISD strategy. Our other school districts. So I think we're up to it.
Thank you. Then my second question is for Dr. Skubinek. Dr. Skubinek, I know you spoke to Sarah just about the process of when you are testing those students and where they're being quarantined at. My question is, how are you following through with those students? Are you checking up on them to make sure they're actually in quarantine? How does that process work to make sure they're being held accountable?
So those who are in isolation, those who tested positive, we check with them regularly. We deliver food to them. For those who are put in quarantine, they're quarantining in place. And so they're monitored through the residence halls that are here on campus. But I can't say I actually am not aware of the extent to which we're monitoring those who are in quarantine off campus, but that's something we could get to you and find out more about.
Okay, thank you.
Thanks, Matt. Next, we have Olga Aguero, and she is with the El Editor.
Good afternoon to everybody. Bienvenidos. First question that I have is for Dr. Cook, is for the vaccine. Once we get a vaccine, you'll be one of the first ones to receive it. You lucky one. Because since we have 1 through 4 phases. But say the vaccine hasn't gone through its full trials, would you still take the vaccine?
Thank you, Olga. That's a very interesting question. Can you hear me okay? I was just making sure. My internet went down, so I'm having to use my phone.
I hear you.
Thank you. So the vaccine, what's amazing, it usually takes years to get a vaccine out on the market. But this is a global, not just the United States, but a global effort to get this vaccine to the market. I have confidence that they will make sure that we won't try to short circuit any kind of safety measures to make sure that this is a safe vaccine for everybody. They will test it extensively, but I think we should watch and be careful. I'm not always one to make sure that we get that you use a new drug, that I use a new drug. I think in high risk individuals, I think we should probably go ahead and use the vaccine, and it will be allocated most likely to high risk individuals and frontline individuals first, and then it will be handed out to other individuals. And so, and then actually trying to mass produce millions of doses, and it looks like it's probably going to require 2 doses, an initial dose to build up your immunity somewhat, and the second dose is to boost that up over the top to make sure that we have enough immune response to make it safe to protect us from COVID.
Thank you. The second question will either Mr. Massengale or our Pope, our Mayor Pope, and it's for the outside county gatherings. I know inside the city limits is you, Mayor, but for the outside, it's not necessarily the county judge like we were told at one time. And correct me if I'm wrong, but it's the sheriff. Is that right?
I can't speak for the county, Olga, but the way I understand it is the county judge could address some of those outdoor events.
We're all in this together, so we should know, right, Mayor?
The county judge has responsibility, but he has to work with the sheriff for enforcement. Remember that they're both elected officials. It's a different setup than at the city, where the police chief is an employee of the city.
Thank y'all. Have a beautiful day.
Thank you.
Thanks, Olga. Next, we have Christy Martinez Garcia, and she is with Latino Lubbock.
Thank you, with Latino Lubbock Magazine. And as you, Mr. Pope, are also elected, but let me just refresh. Catherine mentioned that a lot of these numbers were for gatherings, parties, and we seem to be getting a little bit of mixed messages, because then Councilman Massengale reported about the 10 to 49 checklist, the self-certification, and the 50 or more with mayor's approval, which I think that a lot of people really still are not understanding that concept. And more so, the other thing that we're still seeing is parties. And last week, Mayor, you said that you would be enforcing these parties and making sure that they were not happening, but they seem to have. So my question is, what are you going to do now that we're going to see, because, you know, Steve really put an emphasis on tailgating, even though we don't think people are going to have issues, they certainly are going to have issues. So how are you going to enforce those?
So let's talk about the parties. We have and will continue to enforce our guidelines around parties, and we will do our job in providing for safe neighborhoods. Remember that the test results that we saw yesterday, likely the contact may have taken place as much as 14 days ago before they showed as a positive. Not necessarily, but it could have. We'll continue to do that. We're going to stay the course on that. It's easier to say than to do. I think you would agree. And I think the reason we want people to register their events is because, first of all, it's the governor's law, but it allows us then to spot check and to go by and encourage folks that are doing it the right way. And we're going to continue to do that with our fire marshal's office, with our with Lubbock Police. That's our commitment, and we'll stay the course on that.
Steve, are you going to add to that?
I would add, first off, on the event approval, is that Lubbock has done a great job. We have many different types of events that have gotten in a great rhythm of contacting the mayor's office, and we work with them on that. They might send a plan, and we'll review it, and we review plans every day. We get event requests every day. We work hard to get them turned around, and we'll make suggestions on them. I worked with a group that's having a soccer tournament out at the soccer complex yesterday, and we improved their plan. As it applies to tailgating, I believe we can tailgate safely. I believe we can play football safely. I believe we can attend football safely and enjoy football safely. I've said it many times, common sense and good judgment. And I think it's important that we put these guidelines out so people know how to enjoy themselves and enjoy themselves safely.
President Skovanec, by the way, you guys have been very transparent and it is very much appreciated, but we just heard the emphasis on safety. And as you know, you can do all the planning, but it doesn't always work out that way. My next question is, as of September 2nd, today, the United States is now the worst affected country with more than 6 million diagnosed cases. And locally, we continue to see these deaths almost on a daily basis. Rural communities continue to see increases in cases and deaths. Catherine, what's different? Why are we seeing more deaths? And, you know, we are taking the precautions. Why are we seeing more deaths? And I know that we want to be cautiously optimistic that is, but sometimes I don't know if saying we're doing great and we're being safe, but then we're seeing deaths. So how is it different?
And I think, sorry, Christy, with the deaths, these aren't people that got COVID or were infected with COVID in the last week or the last 2 weeks. People can be hospitalized for a very long time. So some of the deaths that we're seeing now, unfortunately, are individuals that, you know, have been under the care at the hospitals. You know, they've taken lots of measures and unfortunately they've succumbed to, you know, something related to COVID. We're not seeing the outbreaks in the nursing homes and those types of things that were causing large numbers of deaths before.
You said earlier that we're seeing the outbreaks as a result of these at-home gatherings and parties. Are you a little bit concerned that we're going to have tailgating, especially in a time when Texas Tech has cut down to 25% only for people that can actually go to the games, and they have cut 40 jobs, and now we're encouraging tailgating? Is that a concern to you, Catherine?
I'm concerned about gatherings that don't have rules in place, that haven't gone through an approval process. I'm concerned about, you know, 50 people in a backyard without masks on. That's where we're seeing the transmission. We are not seeing it in organized events that have been approved by the mayor's office.
Thank you.
Thanks, Christy. Next, we have Adon Rubio with the Daily Torador.
Hello, everyone. My first question is for President Skovanec. And now I remember on the first day of school, you mentioned that the university will utilize more micro closures in the event of COVID-19 case spikes. So I was wondering, with these current spike, are there any plans to implement some micro closures? If so, where at on campus?
So Adon, we actually addressed that yesterday as we began to discuss that when we get to a point when we may have to alter our course. And so how would that be? How would you see that? Possibly in certain dorms, there could be restrictions put, but the students have to stay in place. We do the testing. When we originally discussed micro closures, we were thinking of specific classes that might be courses that would be identified as a hotspot, but we're not seeing that right now. We can't point to one particular class in a particular building where it seems to be more of a problem than another. But that would be one way in which we might implement micro closures, where a certain course, a large lecture course, would have to go online. So our discussions right now, if we get to the point where we have to make a change, it would be more campus-wide. As I mentioned earlier in my comments, that we might as they've done at other universities, go to online for 2 weeks to more or less keep this part of the population separate from the outside population. That will be a real challenge. We'll have to deliver meals to all the students and such, but that's what we have to be prepared to do.
All right. And I guess just for my follow-up, it was mentioned earlier that obviously the city and Texas Tech are working together in terms of law enforcement and enforcing certain guidelines. And I know you mentioned, like, again, on the first week of school briefing, that the university is trying to be as least confrontational as possible. Is that mentality kind of going to change as cases start to continue rising?
So, Adon, are you addressing that to me?
Yes, sir.
Yes. We had a meeting with our chief of police maybe 10 days to 2 weeks ago to explain our concerns about patrolling the campus to make sure that we have some supervision, a presence to discourage large gatherings where people aren't adhering to policies. And the Texas Tech Police Department has been very cooperative. We also then followed up with a meeting with the mayor to talk about how we could cooperate more extensively with the city in monitoring these events off campus where we think there's irresponsible behavior going on. And the mayor and we just reaffirmed our willingness to work together to identify those spots and to respond to them. And of course, we don't want to do this in a confrontational way. You know, in some universities, they've arrested students. They've suspended students. At least at this point, we want to work in a way that's as non-confrontational as possible, but be prepared ultimately to make those more difficult decisions.
All right. Thank you all.
Thank you. Next, we have Terry Furman with KLBK News.
Good afternoon, everybody. My question is this. Governor Abbott tweeted this week and hinted that he may expand the reopening plan soon, but if he does open up or relax any current restrictions, but Lubbock still has a very high number of positive cases and we keep seeing an increase. Mayor Pope, can you as mayor see some restrictions locally? Can you keep some of those if needed?
Terry, thanks for your question. It's hard for me to answer a hypothetical. I think it's important that we work on where we are today and plan for tomorrow. I've not heard anything from the governor as to a reopening. It seemed to me like, I think I read this, maybe the same tweet you saw or the same release. And initially it sort of sounded like maybe reopening, but then he talked about Labor Day and see what happens after Labor Day. And I know from when he was in Lubbock 3 weeks ago, schools being reopened, higher education, K-12 is very important to him. And I think he's going to watch that very closely before he makes any further decisions. As he makes decisions, we'll look at how they impact us and work together to make best decisions for the citizens of Lubbock.
Very good. Dr. Skubinek, my next question is for you. What is the game going to look like when Tech takes on Houston Baptist in about a week and a half? What are we looking at as far as seating in the stands? Will it be by group or just by individual ticket holders, or what's that going to look like?
So, as you know, the capacity will be limited to 25% in the bowl area. And Kirby and his staff have been working on this for quite a while. Families may be allowed to sit closer together, and then there would be spacing between rows. Accessing concessions will be handled differently. And so families and such may be closer together, but there will be adequate spacing between people to enforce social distancing as much as possible. I think a good example of how that could work was at the memorial service for Tommy McVeigh. If you were in that facility, there was an empty row between seats that were occupied, and there was spacing within those rows, and that's similar to the plan. Also, there's been a lot of planning as to how you enter and leave the stadium. And there's a wide range of minutia they've had to get into that is going to try to make this as safe as possible.
All right, wonderful. Thank you so much.
Thanks, Terry. Next, we have Yahaira Hernandez with Telemundo.
Thank you, Abby. Good afternoon, everyone. So my question would be for Dr. Cook. So is the spread of cases in people 30 and under now similar to back when bars were still open? Does it appear for you that private gatherings are doing the same thing bars were doing when they were open?
Yeah, Haida, thank you. I don't have that data comparing what it was before, but common sense would say that's the age group that would patron those facilities. And so I think common sense would tell you that it is the same sort of group. There might be some mild variance in there, but certainly I think that, yes.
Okay, well, thank you.
Mm-hmm.
And my next question would be for Catherine. So do you think there are enough contact tracers in your department to work these cases, especially right now, since college students have returned and we've seen now a more increase of cases?
Yeah, I think we're very well staffed. We have increased the number of staffing at the health department specifically for contact tracing. And that's in addition to the contact tracers that Texas Tech is providing, in addition to assistance that we're receiving from our school districts. We have a lot of people working on this, making those contacts and making sure people, they know they're positive and following those isolation guidance.
Awesome. Thank you so much.
Thank you, Yahaira. And finally, we have Blair Sable with Fox 34.
Hi, everyone. Good afternoon. Last question, so everyone can breathe a nice sigh of relief. So my first question will be for President Skubinak. And again, thank you for joining us on this call. I know you mentioned a few weeks back that doing all the media avails was a lot, and we understand. My question is just a follow-up in what you mentioned in your statements about a possible campus-wide return to online classes for 2 weeks. So you said that right now, as it stands, the case numbers are manageable, or you believe that it's manageable. Is there a certain point that you and administration believe that those cases will not be manageable? Is there a number? Is there any sort of thing that you've identified that will be the breaking point that you will return to online classes?
Yeah, Blair, that is a very good question, and I think our answer has always been a bit frustrating to people because we're reluctant to give a number. What we'll be monitoring is the total case count. We'll be looking at the rate of increase. We'll look at the number of places we have to provide self-isolation for those that test positive. We'll have to confer with the city, medical authorities, medical experts. So right now we're at less than 1%. I know that number is going to go up. Those schools that have made a dramatic change were well into the teens as a percent of population before they made that change. I'm not saying that's the standard we're going to use. I've discussed this with the provost. What would be a level of absenteeism that would cause us to make that change? So we're looking at a whole number of issues. The count, the rate of increase, absenteeism, our ability to provide space off campus for our population. And then we'll be conferring, like I say, with medical experts, health authorities, and the city. And so there isn't a magic number at this point. And I've conferred with others at other universities, and no one has yet been offering such a hardcore benchmark that would cause us to make that change. But we're prepared to do it, to alter our course, and we have begun to plan for that.
Right, and I can understand that's a difficult decision to make. And just as a follow-up, again, for you, President Skubinak, have you heard back from any students, faculty, even parents concern about the case increases on campus, and is there any push to make that decision to return to online classes?
Yes. We heard this morning from parents when they saw the spike in the positive cases. But throughout this entire opening, we've had a steady stream of communication from those who are encouraging us to move forward with some degree of face-to-face and those who were not comfortable with that. In the case of those who were not comfortable with it, we worked individually to make sure they could have a course schedule that was mostly online, if not all online. I think you're going to see an increase in the amount of concerns provided by parents, and it's really incumbent upon us to make sure we're responsive. I think what we can convey to them now is, for instance, in the dorms, as I said, with more than 7,600 occupants, we have less than 100 cases. We still feel that it's a safe environment. And when we feel that we can't make that statement, then we'll be prepared to make changes.
Thank you so much.
Abby, before we finish, I want to tag onto that and just, first of all, thank Dr. Skovanec for joining us today. He's got a lot going on. And I want to remind everyone that we share the responsibility for the safety of every boy, young man, young woman that comes to Lubbock to go to Texas Tech, whether they drive across town or across the country. And we'll continue to work together to make sure that we provide an environment that is as safe as possible.
Thank you, Mayor Pope. And that concludes our media questions for the press conference. Again, I want to thank the panelists